All right, let's dive right into this explainer and give you a clear, actual map to navigate a prostate cancer diagnosis without the fear and, more importantly, without the future regret. Hearing the word cancer from your doctor is literally one of those moments where time just stops. Your brain freezes, and the immediate instinct for so many of us is to just absolutely panic. But today, we are going to replace that panic with a solid, actionable plan. We're looking at the hard data behind treatment choices and how you can make a decision today that you won't be kicking yourself over 5 years down the line. First off, let's just take a collective deep breath. Every single year in Japan alone, over 100,000 men are diagnosed with prostate cancer. I'm sharing this number right out of the gate to show you that you are absolutely not alone in facing this incredibly overwhelming moment. And actually, because it's the most common cancer among Japanese men, we have this incredible, rich data on how different treatment choices actually play out over time. So when that initial panic sets in, it is so easy to just make a rush decision. I mean, you just want the cancer gone, right? But the data shows that 5 years later, a very specific group of patients experiences deep, profound regret about the path they chose. And surprisingly, it isn't always the group you might assume. We're going to uncover exactly who regrets their choices and why, so you can completely avoid falling into that exact same trap. To help us get there, here is our roadmap for today. We'll go through the pitfalls of rush choices, your risk classification map, the 3 main treatment paths, the reality of complications, and finally, your next steps for your clinic visit. Okay, starting us off with Section 1, the pitfalls of rushed choices. The immediate emotional shock of hearing you have cancer is incredibly heavy. It's terrifying, and it forces this sense of extreme, almost frantic urgency. This perfectly captures the initial reaction of patients like Kondo-san. He was a 74-year-old former postman, feeling totally healthy, just out tending to his farm every morning. Then a routine health check flagged something, and boom, diagnosed with prostate cancer. His head went completely blank. Driven by sheer terror, his first reaction was literally, "I want it out right now." He demanded surgery on the spot. And look, it's a completely understandable human reaction. But as we'll see from the data, rushing straight into the operating room without fully grasping your specific situation, it can be a massive mistake. Which brings us to Section 2, your risk classification map. Before making any irreversible choices, you absolutely have to figure out exactly where you're standing. You do this by determining your risk classification. Think of this as the foundation of your entire journey. Your doctor is going to figure out if you're low, intermediate, or high risk by combining 3 crucial coordinates. First is your PSA. That's a blood test indicating prostate abnormalities. But keep in mind, a high PSA doesn't always equal cancer. Sometimes it's just inflammation. Second is the Gleason score. This basically grades the face or aggression level of those cancer cells. And third is the spread. Has it actually moved outside the prostate? You need all 3 of these coordinates to map your true risk. Knowing your risk is your non-negotiable starting point because it completely dictates which treatment paths are actually open to you. For instance, if you're high risk, active surveillance is just off the table. You have to look at surgery or radiation. But if you're low risk, kind of like Kondo-san from our earlier story, rushing into surgery totally ignores the fact that you have other, highly viable, much less invasive options available to you. Moving right along to Section 3, the 3 treatment paths. Now that you know how to read your map and find your starting coordinates, let's look at the 3 distinct roads you can actually take. You generally have 3 main options. First up is surgery, where the entire prostate is removed, often using those advanced robotics like the Da Vinci system to just completely eliminate the cancer. Second is radiation, which is an outpatient targeted therapy that avoids a hospital stay by attacking the cancer from the outside. And third is active surveillance. Now, this is crucial. This is not just throwing your hands up and doing nothing. It is a rigorous, medically supervised monitoring program with regular tests, and you're ready to pivot to surgery or radiation the absolute second the cancer shows signs of progression. Okay, so the vital point to grasp here is what we call the one-way street rule. Think of your treatment choice like driving your car down a one-way road. If you choose surgery to remove the prostate and the cancer happens to return later, you can often still have radiation therapy afterward as a backup. However, if you choose radiation first, subsequent surgery is incredibly difficult and honestly, in most cases, impossible due to the tissue damage caused by the radiation. You really need to know which escape routes are open before you commit to a path. Let's get into Section 4, the reality of treatment complications. We have to look really closely at the obstacles on these paths, because the real driver of post-treatment regret isn't necessarily the side effects themselves.
It's being caught completely off guard by them. Looking at the hard data on this, a 5-year study reveals a super surprising trend. 16% of men who chose surgery felt regret compared to 11% for radiation. But get this, patients who were eligible for and chose active surveillance, they actually reported the lowest regret, just 7%, meaning they had the highest psychological satisfaction 5 years down the line.
So, why does surgery have the highest regret rate? The data points to what we call the regret trap. The greatest source of regret wasn't just that complications happened, it was this massive gap between expectation and reality. Men who rushed into surgery just weren't mentally prepared for the severe disruption to their daily lives, mostly because they didn't fully understand the anatomical consequences of removing the prostate. When you anticipate a challenge, you can endure it. When it totally blindsides you, that's when you regret it. Let's break down the anatomy of that reality for a second. Because the urethra, that's the tube you urinate through, runs like a tunnel straight through the middle of the prostate. Removing the gland means actually cutting and reattaching that tube. This frequently leads to periods of urinary incontinence, where simple, everyday things like sneezing or just standing up cause leakage. On top of that, vital nerves controlling erections sit right on the surface of the prostate, so surgically removing the cancer often impacts these nerves, leading to erectile dysfunction. These are hard realities you absolutely must be prepared for if you go down this path. Now, radiation has its own realities too. It doesn't require a hospital stay, and a lot of folks think it's the easy route. But you have to be ready for what are known as late complications. These are things like severe bladder or rectal inflammation and bleeding that can surprisingly just pop up months or even years after your treatment is totally finished. Choosing radiation means committing to years of careful observation, long after your clinic visits actually end. Let's jump back to Kondo-san, our panicked former postman. Fortunately for him, his doctor pumped the brakes and gave him this exact reassurance. You don't have to remove it immediately. Let's watch it carefully. Because he was low risk, he was perfectly eligible for active surveillance. He took a breath, totally avoided the complications of a rushed surgery, and here we are 5 years later, he's living without regret, happily tending to his farm every single day. Finally, let's wrap up with Section 5, Next Steps for Your Visit. Let's turn all this into a concrete action plan so you can take back control of your health at your very next doctor's appointment. Preparation is your absolute best defense here. If you're leaning toward or scheduled for surgery, start doing pelvic floor exercises right now. Literally squeeze and release those muscles while you're watching TV. It dramatically speeds up your urinary recovery post-op. Secondly, never ever go to a consultation alone. Always bring a family member to be a second set of ears. And third, with your doctor's permission, record the audio of the visit or rigorously write down the answers. Stress causes memory blanks, you know? A recording doesn't. I want you to physically write these 5 specific questions down on a piece of paper and take it with you as your shield. 1. What is my exact risk classification? 2. Based on that, what are my available treatments? 3. If I choose surgery, what are your specific rates for incontinence and ED? 4. If I choose radiation, what late complications should I be watching for? And 5. I would like a second opinion. Can you write me a referral? Honestly, any good doctor is going to welcome these questions. So it really all boils down to this. By demanding clear answers and fully understanding the physical reality of your choices, you completely transform from a panicked patient into an empowered decision maker. Take a breath, understand your map, and step forward into the future knowing you've made a choice you won't regret. But it really begs a bigger question. How many other areas of our healthcare are we just navigating blindly simply because we haven't asked for the map? Thank you so much for joining me on this explainer, and I'll catch you next time.